Hello, everyone, and welcome to the Purposeful Learning Festival 2021. My name is Stephanie Scott, and I'm the marketing director here for O'Donnell Learn. And we are excited to have you join us for today's session, Healthy Mind, Strong Learning, Charting a Course to a More Aware Community and Sustainable Mental Health, with our special guests from the University of North Carolina System. This discussion will be led by our own John Falchi. John is the Vice President for Product Management at O'Donnell Learn and the former UNC System Office Director for Online Learning. He's also a doctoral candidate at Indiana University, where he is studying student perceptions of adaptive learning to inform pedagogy and instructional strategies. We will be sending out resources to all of the attendees, including the recording and slides. And now I will hand over the webinar to John Falchi. Take it away, John.
Thanks, Stephanie, and good afternoon, good morning, depending on where you are and where you're joining in from. Again, my name is John Falchi, and I just wanted to touch on a little bit of the framework for our discussion today, as well as introduce from a very high level the UNC System team. So first of all, the panel that we have with us today represents faculty, staff, and students from the UNC System. And they're going to be explaining their work with mental health initiatives and will briefly introduce themselves during this short presentation. So we won't go through all introductions at this point. Our system participants will introduce themselves during their segments of their presentation. Now, with regards to the framework, what we're trying to create here today is a very collaborative, engaging discussion. And our guests are going to frame that discussion based on a model that they've been implementing, as well as some of the lessons learned and next steps that they're going to be taking in this area. So they're going to go through their presentation, and then from there, we'll start to address questions and dig a little deeper with the help of our guests. So with that, let me turn it over to the UNC System team, and I think Kim will be driving from here.
Thank you, John. Can you see the PowerPoint?
Not yet.
Okay.
There you go.
Awesome. So thank you so much. As John said, we're going to introduce ourselves as we get to our portion. We represent constituents of faculty, staff, and students, as well as UNC System staff on this presentation, and we will begin now.
So good morning, everyone, or good afternoon. My name is Toya Corbett, and I serve as the Assistant Vice President for Student Affairs at the UNC System office, and I served as one of the co-leads for the UNC System's Mental Health Initiative. The Mental Health Initiative actually began almost a year ago, so October of 2020. During one of our Board of Governors meetings, they tasked the System office with addressing the growing needs for mental health resources and services at all of our 17 institutions. And there were three questions that we wanted to answer when figuring out, what quite to do and how to address this issue. The first question was, what is the appropriate level of mental health service that the UNC System institution should strive to provide? And how should the system measure whether that level of service delivery has been achieved? Are existing funding sources sufficient to meet the standard across the system? What alternative revenue models should the UNC System consider? And what are best practices and innovations should the UNC System and its constituent institutions consider to improve the delivery of student mental health services? After several meetings and conversations, we kind of broke this initiative down into three working groups, one being promising practices to assess the best practices across the system. Second group was measurements and outcomes, looking at data. And third, of course, finance, funding, and revenue model to address how do we pay for all these resources that students need. And considering how the pandemic exacerbated mental health across not only with our students and faculty and staff, just with everyone, we wanted to make sure, more importantly, that we were able to successfully address all of the needs throughout our unique 17 institutions, whereas we also have a high school, we have rural institutions, and we have very large Research 1 institutions. And so fortunately, we were able to, after several months, finally put into place and implement some things that are happening right now. One being implementing protocol across all 17 institutions. Protocol is an after-hour telebehavior health service that when the counseling center closes at 5 o'clock and the staff goes home, students still have access to a live mental health professional that they can call from 5 p.m. really until 9 a.m. the next morning when the counseling center opens. Very fortunate that our president, Peter Hans, saw this as an important need, and the system office paid for this service for all of our 17 institutions. And a few months ago, we were funded by the governor of North Carolina with $5 million to fund some of these mental health initiatives, and one being protocol for a second year. It's a very expensive service, but it's very needed to address those students who, of course, are going through suicide ideation, which normally occurs in the morning hours of those who just need someone to talk to. Protocol also will contact police officers or are able to help students to find medical care after hours. And one of our other initiatives that we have instituted is Behavioral Health Needs Grant. There was an RFP sent out a month ago. We're very excited that we're going to be able to fund institutions who successfully apply for this grant up to $100,000 to meet the needs, the growing mental health needs of their campus, whether that be through staff development, any type of equipment that's needed, particularly for new laptops with cameras, headphones, to be successfully to implement telebehavioral health. And we're really excited that that's going to be a game changer for many of our institutions, going from very small budgets to now having an opportunity to be funded up to $100,000, which is going to be spread across 2 years. We're looking at implementing an off-campus referral network, a shared service between all of our 17 institutions that they can tap into providers across the state. So whether a student lives in Western North Carolina or on the eastern side of the state, they will always have access to a counselor or a provider. We're going to provide micro grants for an off-campus referral service for those students who may not be able to afford, or their institution or their insurance does not cover the needed psychiatric care or other long-term mental health care that they need. We're going to be able to provide funding for that. And one of our major initiatives that you're going to hear about in just a second is mental health first aid that is being implemented not only within the UNC system, but across the state of North Carolina between all of our public and private institutions. And so the next group with Kim Mitchell is going to tell you more about mental health first aid.
Okay, thank you, Dr. Mental health first aid can really be compared to physical first aid. It's designed for everyone, regardless of your background. So you don't have to have a mental health background in order to participate. It creates a more aware individual and also gives some language to address mental health concerns for people that might necessarily not have that language already open to them. There's
Kim, you're muted.
Okay. Oh, someone else muted me. I didn't do that myself, but while I did that, I forgot to introduce myself. My name is Kim Mitchell, and I'm the director for student development and AHG advisor at the UNC System office. So again, mental health first aid is really comparable to physical first aid. There's 2 levels. There's an instructor level. So that course requires 3 days of training and 8 hours pre-work, as well as some follow-up work. And those people are then certified to train the basic mental health first aider. The basic class is an 8-hour class, and anyone that goes through that course is certified for 3 years, a lot like physical first aid. So our plan to roll this out is we have 116 institutions in the state of North Carolina. Like Dr. Corbett said, when we were given that $5 million of Gear 2 funding from the governor, we were also given the challenge that not only to roll this out for our 17 institutions, but the 58 North Carolina community colleges and 41 private independent colleges across the state of North Carolina. Our plan for doing this is to use this funding to offer 2 seats in an instructor course for each of the 116 campuses. And we're asking each of those people that are getting this certification to then train up to 90 people each, which would bring at least 10,000 mental health first aiders across the higher education in North Carolina in the next 15 months. So we're working on that now. We had a pilot course August 4th through 6th where we had some UNC System staff, including a police officer from each one of our campuses, participate to be a trainer. And starting next week, we're going to start rolling out a series of 13 courses that have members from all 3 types of institutions that will become trainers. And now I'm going to let you hear a little bit about the plan, because we're rolling this out not only for faculty to teach students, but this is a faculty, staff, and student initiative. We have faculty, staff, and students that are all trainers. We also are hoping to have faculty, staff, and students as part of that 10,000 mental health first aiders. So I'm going to turn this over next to our next speaker. Oh, sorry, I'm having all kinds of technical difficulty today. And we will learn more about Elizabeth City State University's faculty outlook.
Hi, I am Casey DiGiacinto. I am a full professor of kinesiology at Elizabeth City State University. And I was offered the opportunity to participate in the instructor training because of my association with UNC System Faculty Assembly. And I was very excited to participate in the training. And our rollout, well, I have to say there are at least 4 other people on my campus trained in mental health first aid as instructors. And currently the university has us working separately. So this is just my plan for my rollout to meet my trainer requirements or instructor requirements. And currently we are setting up our first faculty opportunity. It will be targeted to those faculty in our Health and Human Studies department, and then opened up to the full campus faculty for the first training of 30 individuals. Once that happens and we have a lot of faculty trained in mental health first aid, we see that as faculty being able to directly help the students who might exhibit any signs in class or during meetings and things like that. The next step would be to open it up to students, trying to target those that will be working related to the health professions. So starting with health and human studies again, and then opening it up to the wider campus for students who would like to be certified. I would like to say that my department chair of Health and Human Studies is very much behind this program. When I told him that I received my trainer or instructor certification. And so he wants me to immediately start looking for grant money to be able to offer trainings to our community, to our K through 12 educators, and to then our community at large. He just sees this as being as important as I do to help train others to be able to help individuals. And I am lucky to have that kind of support.
Hello, my name is Chess Kennedy. I am the coordinator for the Spartan Recovery Program at UNC Greensboro. My program works with students who are in recovery from alcohol and other drugs. And it's a program that sits in, like any good recovery program, sits in the basement of our student health building. and we are relatively small program, around 60 to 70 students at any one time. And this student mental health first aid has given us a great opportunity to reach out to the community or to the university at large, to sort of talk about what's important to people in recovery and substance use disorders, because mental health first aid addresses substance use disorders. And so we're excited about this program, being able to get it out to the community of the university. So one of the things it teaches us, and poor Kim today, is the Zoom, how to work Zoom. And she's a champ so far, because it is hard, especially as soon as you start trying to use it in a group like this, all of a sudden everything goes wrong. So way to go, Kim. So at my campus, there are 3 other trainees. 2 of them are students, and 1 of them is a police officer. So both of the students are students that are affiliated with the Spartan Recovery Program, which is the program I'm the coordinator for. And we are we're just putting our first course together, and it should be done by the 18th or 19th of October. And we're anxious and excited about it at the same time. There's a lot of moving parts, and that's the fun part and the scariest part, actually. But in terms of what we're planning on for a rollout, one thing that we know, and my background is in development here at the university before I took this position, and engaging with our board of trustees is extremely important, because as a university to find new funding and revenue streams, the board of trustees can be great advocates for that. So one of the things that I'm working toward is preparing a presentation that I can make for our board of trustees, and the one that I can share with even other system folks, and in terms of teaching them about what we're doing with mental health first aid, why it's important, how it works, what are the outcomes from it, which the organization Mental Health First Aid has amazing research to back up the work that's done. So one of the things is getting the board of trustees behind this program, maybe even having them participate in the 8-hour coursework. The second part of that is making sure that our faculty and staff are on board. You know, Casey talked about her faculty being excited about it. That is the situation that I'm finding here at UNC Greensboro as well. When we've talked about offering it, they are blowing up my emails asking when can we take this? And I'm excited about that. With this first course that we're teaching in a couple of weeks, I'm setting the limit of 20 people to take the course, and we're about halfway full. And I haven't even offered it to some of the faculty or some of the staff who are interested in taking it. I've just sort of the subversion of it to students that I know who would be a good audience for my first presentation. So we expect to fill that up very quickly once I make it more public to the university. I'm addressing it in the same way that Kim talked about it, as being sort of a CPR type thing, except for mental health. And when I've talked to students, faculty, and staff, they've all agreed that this is something that they want to understand and they want to be able to participate in, because we all have experiences where we have a friend who might be having a mental health challenge and we just don't know what to do. And mental health first aid is a great resource in giving us some confidence and ability to be able to address those situations in really careful and kind ways. The other thing that I'm doing, I'm actually a faculty member as well. I teach in the religious studies department. And my course that I'm teaching this semester, I've decided to take, they're 3-hour course evenings, like Tuesday nights from 6 to 9. And I'm taking 2 of those nights of class and committing those to mental health first aid. So the students that are in my class will be part of that first cohort here at UNCG that will have the training. And I'm encouraging, once faculty sort of see the program and understand how it works, I have a feeling a lot of faculty will want to do the same, because a lot of courses, the opportunity to do maybe your first or second week in the semester with a program like this gives you a good starting point for conversations and building community within a classroom. So as a pedagogical sort of tool, this is mental health first aid is very exciting for us, and the possibilities that we see. I mean, I'm speaking for everybody, that Ray and for Casey and for Kim and Dr. Corbett. This is a great opportunity for the universities to really make an impact on mental health in our state. So thank you.
Thank you, Jess. I'd love to now go over a few things in terms of students, but right before that, would love to introduce myself. So, hey everyone, my name is Ray Palma. I'm currently a junior at UNC Chapel Hill, and I currently serve as the president of the UNC Association of Student Governments, or a little bit more, I guess, commonly known as UNC ASG. So in that role, I am the student representative for all the students across the 17 institutions in the UNC system. I work with student body presidents, student leaders from across campuses, set up spaces for them to, be able to talk with each other, share, and advocate on all their behalves as the student member of the UNC Board of Governors. So going into a little bit of the student outlook for mental health first aid. As we all know, we're all in and around higher education. So mental health is, so incredibly important to well-being and success of students, especially in the pandemic, and likely in whatever post-pandemic world we have in the future. At least with the pandemic, students a lot of students were in isolation. They may have been at home as opposed to on campus. They were losing out on some of the, I guess, so-called best years of their life. And then, with Zoom fatigue, I think we've all felt Zoom fatigue at some point, but especially from a student standpoint, you would open, you'd go to class on Zoom, and then, no change of scenery. You just continue on your computer for homework and meetings and everything else. And so it was very difficult on students, as I'm sure everyone here understands. And so a lot of SGAs, because of that, and even before that, we're very passionate about mental health and wellness, and have been working on initiatives in recent years. And so to me, mental health first aid is an incredibly amazing opportunity for students to not only better understand what mental health is and what mental health first aid is, but also be able to better support their peers and their experience. For me personally, a reason that I wanted to be a mental health first aid instructor was that, throughout my life, I have struggled with different mental health challenges in the past. And, throughout those times, I wish I had someone who was familiar with the signs and symptoms of mental challenges, and, had been able to reach out and support me. And so, in terms of that, mental health first aid won't just allow people to better understand how incredibly important mental health is, but by being trained in mental health first aid, students will be able to better support their peers and the overall college experience here in North Carolina at different institutions, which to me is incredibly important. And then so finally getting to the, what we're doing on a more student government level. So we're currently in the process of working with student governments of the different institutions from across the state to build awareness of mental health first aid, but also organize and host SGA-sponsored courses to students. So I've been in contact, and Ms. Kim and I have been working with the different student body presidents and student government leaders from across the system. And we're really excited about those opportunities. A lot of student governments, as I mentioned, have been passionate about mental health in the past. So this mental health first aid, as well as the trainings and the courses, will directly heighten the impact of the issues that students have cared about for a long time. And so with that, I just can't overstate how excited students are about mental health first aid and giving these tangible resources and the ways in which they will help make the student experience even better than it currently is. So thank you.
Okay, well, thank you all. And Ray, I do have to say thank you for sharing your personal background in this area and how that has touched and helped to drive your need to support these initiatives. Our next steps here. First, let me say thank you to the system faculty staff for sharing the initiatives that are going on at individual institutions, but as well as sharing the system-wide initiative and support for the institutional initiatives. I think that's very healthy, having come from the system office and understanding how that dynamic works. I think that's a really important piece. What we're going to do next is, I believe there are questions that are starting to develop in the chat area. And if participants would like to submit a question to be posed to our panel, please feel free to post those in the chat area. I do have a couple of questions to kind of kick off this collaborative discussion at this point. And I think, Ray, I think I'd like to start from the student perspective, understanding that the mental health challenges that we're focusing on, that the system is focusing on, is not just students, it's faculty, staff, and students. And as Dr. Corbett has pointed out earlier, you know, they've been exacerbated over the period of COVID. But I'm really interested because, and I'm going to try to tie this together. I'll try to make the question as short as possible and as concise as possible, but I think there's a couple of things to summarize here. So when we talk about the efforts at UNCG, ECSU, and at Chapel Hill, as well as you representing as a student, it's one thing to think about is the misperception or the perception of student life, as well as the stigma that goes along with some of these mental health challenges. Now, understanding over the last 30 years or so, there's been a lot of progress in that stigma. And I think that folks are really starting to understand mental health as something that can be treated if properly identified and diagnosed and so forth. But what I'm really interested in understanding is, when we talked about the ECSU approach to rolling out this training, we're going to, I believe I heard, they will start with those who are interested in professional health, and then it'll get rolled out to the general student population. And I guess from your perspective and lessons learned, what you're seeing on these various campuses, what are your thoughts on this type of training and students' ability after taking this training to identify and spot in social gatherings and outside of the classroom someone who might be going through this and isn't even aware of what this is that they're going through? And then how do you, as a student, work with them or bring this to the appropriate support mechanisms at the institution, right? So I think there's a question in there somewhere, right? So part of it is, how will this training support that? And how important is it to get this training out into the general student population and being able to spot these things outside of the classroom, when many times some of these students won't even be showing up for class?
Yeah, absolutely. No, thank you for that question. I'll try to take a stab at it. I think that, as you mentioned, there has been historically a big stigma around mental health challenges, especially among students. You know, in college, I think a lot of times, you know, you're peer pressured into trying to put on this facade that everything is great, everything's okay, that, you know, it's the best years of your life. But, you know, as we all know, too often that's a lot of times not the case. You know, you can be stressed about, you know, your schoolwork. You can be going through challenges at home, whatever it might be that, you know, lead to different mental health challenges. But a lot of times, you know, it's as you mentioned, a little bit difficult to identify those within yourself, but also, you know, among your peers. And so with that, you know, the trainings really offer students the ability to better understand the sort of the concept of mental health, as well as mental health first aid, and gain the skills to help themselves as well as their peers better connect with those resources. You know, as part of the training, one thing that we really learn is that, you know, you're not there to, you know, solve, you know, your friends or your peers' challenges, but more so be a support measure, as well as connect them with professional resources. And so a big aspect of mental health first aid is really understanding what resources are available in your community on your campus. And so I think that's an amazing part of the training, and amazing exercises for students who go through this training to understand what those resources are, and then connect that with the skills they learn in identifying different signs and symptoms of mental health challenges, and just increase the overall wellness of their peers, the student, the campus, and just be able to support students in the best way possible. And so in terms of that, I think it's so incredibly important because, sometimes you'll be in class, maybe like, as you mentioned, a student doesn't show up or one of your friends doesn't show up, or, you're at a party or some sort of event and you can just tell there's something is on the student's mind. So just noticing those sort of small signs and symptoms, and then being able to, maybe pull a person aside and, have a conversation with them and really, check in with them and see if they're okay, and, connecting with those resources if they need it. That's really an amazing opportunity because of how much students interact with each other across campuses. You're every single day, you're in different spaces with different people. And so trying to get as many people or as many students trained as possible, I think will have an incredible impact. Yeah.
Thank you. Thank you for that. And would others like to offer anything in addition to that, or?
Okay. I would.
Okay.
So behind that idea of offering it first to faculty and students in health and human studies, the majors that are encompassed in that department are social work, psychology, kinesiology, and pharmaceutical sciences. And so with kinesiology, psychology, and social work being directly connected to help their professions, helping people with health and mental health, that's one of the reasons we chose to work with them first. But when I say offer it to them first, I don't mean we do it in November for them and then wait and do it in April for the other students. I mean, we give them like a couple day heads up for them to register first. And if they don't do it, it's open to the whole university, and anyone who wants to get in can get in. But we did think that the students in those majors could help people in the now and in the future as they go out into their professions. And at the end of it, we just want to be able to offer these trainings with all seats filled, so that we can hit that 10,000 trained people mark, so that we can help more North Carolinians.
That's fantastic. Thank you for that additional information. So I think there are a couple of questions that are developing in the chat. Let's take one of those on and we'll go back and forth. And so first, I guess this is a clarifying question. Are the mental health first aid courses for college students the youth or the adult ones? Thank you, Peggy.
Yes, thank you. The courses are the adult courses, but we do have a high school as well in the system. So I've reached out to the North Carolina School of Math and Science, and they are going to actually have people go through the trainer course for the youth version, but they also have a person that has gone through the adult version, because we want to, again, recognize that we want them to be able to recognize concerns that they have, that their peers have and their other faculty and staff colleagues. But we also want to make sure that the uniqueness of the youth version of having juniors and seniors in high school, that their issues are recognized as well. So we're with the high school, we're doing both approaches. With the rest of the campuses, it's the adult version.
Okay, thank you, Kim. Here's another question from one of our participants. Are the student health clinics / services personnel connected in the planning and implementation process of the mental health training?
I can speak to that a little bit. I'm not sure system-wide how that's working. Kim, you might be able to answer it better. I know that at UNCG, I am affiliated with Student Health Services. So everybody in the building is aware of mental health first aid, and the counseling team and the student health services is very excited about this, because this adds another layer of protection for students. So I think even if I were not associated with student health services, this isn't fully their, I don't mean to make it sound like this. It's not just their domain. when you learn CPR, you're going to be doing CPR, probably not at the hospital. You're going to be out somewhere else. And it's the same thing with this. It's just that opportunity it's just another layer of protection for our students. So, and part of the training is putting together a list of resources for someone. So for example, if I'm working with someone who's having a mental health challenge, and to be clear, we're not diagnosing anybody. And if you've taken the course, you hear that over and over again. It's true. We're not diagnosing. We're just having an opportunity to have a non-judgmental conversation with somebody, and then to be able to provide them with resources that we ourselves are responsible for putting together. So I need to make sure that I have the suicide hotline available, that I have the counseling center here at the university number available, the other resources in the community available, so that a student or a friend or whomever I come in contact with, I'm able to give them those resources. So it's kind of one of those things where I'm lucky because I'm in student health services, so it's sort of, I know what they think about it. But I would expect that most student health services or clinics would be thrilled, and especially with what I understand is an incredible workload that universities are under right now in their counseling centers. They're not able to help everybody like we would like to be able to. A lot of people are being sent out to outside resources. So to have people on the front end being able to recognize something and to say kind of triage might not be the best word for it, but almost to triage that and to give them the resources they need to go find the help that they need. We're lucky to have that environment for students here. I hope that made sense.
Yes, definitely.
And I'll just add from the plan perspective, we definitely have reached out to counseling center directors and health centers, but we recognize that population might be more aware and more comfortable already with mental health issues. We want to hit the pockets of campus that necessarily aren't as aligned with understanding or recognizing mental health issues. So we're recruiting in recreation. We're looking for the high student traffic areas that the office manager might be willing to be trained. We're looking at recreation, Greek life, other pockets of campus that people aren't not naturally in their curriculum as familiar with mental health signs, and we want to get those people involved as well.
Yeah.
I want to add to that, if I may. I do know that our director of counseling services is certified as an instructor. I don't know what her rollout plan is, but as a stressed out faculty member in 2018, all of our counseling services are only available to students. There is nothing for faculty to on campus make an appointment with and be able to have counseling sessions or anything like that. And in 2018, I suffered from stressed out panic attacks on my campus. And after having 3 and being like in my vehicle, crying and hyperventilating, I had to reach out to another faculty member in psychology and say, I don't know how to deal with this. I'm not asking you to counsel me, but can you recommend what I need to do to find someone? Because I did not know how to access services that were available, if there were any through the system or through our campus, and there really weren't. She was like, call this number on the back of your insurance card. They will talk to you right now, but then they'll give you referral for a professional. And so there wasn't really an instant way somebody could get help for a faculty member. And so I think it's great for me. I'll be having a list of resources for faculty, for community members, and for our students of where they can go to get help. And I just wanted to share that because, you know, not all of our campuses are quite equal on resources. And so just adding to the complexity of how this training can help a lot of different individuals.
Yeah, that's very helpful. I think, you know, we talked about the dynamic between the system office and the individual institutions and working as a team to initiate this program and initiatives. And I do have two questions, and I'm trying to figure out which comes first, but I guess we'll just figure that out. So when you think about as an individual institution, right, and you've kind of, I'll just call it, might receive some of this seed funding from the system, and then you start to implement your program. How are you then thinking about scaling and going beyond the initial initiative, and how do you see that growing and bringing that across the full campus and scaling it to its fullest potential beyond, you know, the 10,000 across the system initially identified?
I'll go first since nobody else seemed to want to speak up. Like as I said on my slide, I have support at my university into thinking that this type of training is important, and so I have a department chair telling me already I need to be grant writing so that we can expand the services beyond what the system can provide and work with our community members. So that's our plan, is to grant write for some of that mental health support that is out there. And thankfully, a lot of it is out there right now because of the pandemic. So unfortunately, that means more people need services, but at least they're supporting grant funding to get people connected with the services and help that they need.
Yeah, and Casey, I hope my question isn't perceived as in a negative connotation. I think you addressed it clearly, and what I'm really trying to get at is there might be other institutions who are tuned in right now, and they might be in a similar position or in the life cycle of developing this program. And some folks might be stuck in the earlier growth of the life cycle. And so I'm really just trying to, you know, figure out lessons learned and you know, how one might get past that sticking point. Right. So I just wanted to clarify my question there.
Oh, no negative at all.
Okay.
And I just wanted, there was a little pause. And so I just thought, oh, if I say something right now, somebody else can formulate what they want to say.
There you go. But if there are no other thoughts there, or are there?
I'll just say, John, I think it is a thought, and I think both Chess and Casey mentioned that they have plans for to take this from beyond. Chess is like going to get buy-in from the Board of Trustees. And we're at the really beginning of this. I think as more people take part in it and buy into it, it'll be a lot easier to argue that this needs to stay around. So yes, your question is very relevant, and it's not negative. And I think it's a question that we have in our heads, and we have some solutions, but we're at the point where we're trying to get through this first stage of this initiative, but keeping that in mind as well, because again, even in the rollout plan, you already heard follow-up plans. These two of our presenter panels.
Yeah. And that brings me to the second question, right? And this is why I didn't know which one to throw out there first, but I think you started to roll out August 4th through the 6th with initial training. And what types of lessons learned are you pulling from the training, from delivering the training, from an outcomes perspective, and what could be offered to our community as how to roll that out and what you're learning?
I'll start, but then I'll turn it over to other people as participants. I think one of the things that we learned from the rollout is that we need to give a lot of information up front because it is a time commitment. There's at least 8 hours of pre-work for the instructors. And then you have the full 3-day course, and then you have follow-up work. And to really be clear about the time commitment, if you think about faculty schedules and staff schedules, everyone everywhere on every campus is extremely busy right now. So carving out that much time when you're already overwhelmed is a lot. So we have to be really upfront about that. Initially, we were, this is what the training is, sign up. And I think some people signed up going, I can do 3 days. And then they realized, wow, what did I sign up for? So that was a big lesson learned. Another lesson is truly trying to find people from all aspects of campus. We do need to have a point person on every campus. We're operating from a system point right now, and without having someone that is the go-to person on the campus, it makes it a little bit difficult to come up with a campus plan because we're overseeing the system plan and getting the training out, but there really needs to be a cohesive campus plan to get that going. I think that's 2 big takeaways or lessons learned that I've seen from organizing this process. I will turn it over because I went through the instructor training as well, but what did my co-panelists learn about that?
I think you described it beautifully in terms of the time commitment. That 8 hours ahead of pre-work, and then 3 days that isn't affiliated with the pre-work. It's more learning how to be presenters and presenting the information with fidelity. That was the big, a big takeaway after 3 days. And I'm using certain words that are like triggers, I think, for Ray and Casey and Kim, who have taken the training because we were, no, we don't diagnose. And yes, we have to do this with fidelity. And that's the plan. I mean, I think that's something we're keeping in mind. I wanted to add one of the things that in terms of like a long-term goal for us as well, and something we learned through the training is that our students are really, Ray's a fine example of this, are perfectly capable of teaching these courses. And we, when I compare it to CPR courses that I can take over at our gym here, this is the same sort of work. And it requires someone who's paying attention, being careful and diligent about the work that they're doing. But for the student, from the student aspect, that's where they're going to learn best. And so I see the opportunity of once this all gets off the ground. Obviously we see this as a broader help for campuses. It's not just students that we're concerned with here. Like Casey talked about her experience, and thank you for sharing that, Casey. I know lots of faculty and staff who have those same experiences. And if they had colleagues who knew how to address those situations, their outcomes are improved. So with that in mind, I don't know, I just think this is such a great opportunity for us to give some of this to students and let them carry it on, because they'll carry this out into the community too. So the training was amazing, though. It was very thorough. And when I joke about learning how to work Zoom, like I've been on Zoom for 1.5 years now, and I finally know how to use it. I know how to do polls. I know how to do different, groups and that sort of thing. So the training is really very well done. I will say that. I think knowing the time commitment is the key and the hardest thing to come to deal with.
Any other thoughts in this area?
Yeah, I'll just quickly build off what Chess and Kim said. I think they both hit the nail on the head. As Kim mentioned, I think that one of the most important things is sort of for people who are interested in potentially becoming, getting trained to become an instructor, is just really sort of reflecting and asking yourself, if you have the time and capacity to do the pre-work and then also the training and get certified, but also can you commit to the sort of being an instructor and hosting those trainings and doing that work, afterwards. Because I think that is, one of the most, I think it is the most important aspect is after getting trained, helping train others to get certified in the future, whether that's, for the faculty on your campus, the staff, the students. So really just sort of taking a, looking inward, seeing if you have that capacity. If you don't, like, I think that's totally okay. And you can still get, go through that, the normal 8-hour course and get certified as a normal mental health first aid individual. But just doing that self-reflection, I think, is incredibly important. But then, as Chess mentioned as well, in terms of students, I think it is something that is very doable. It might be a little intimidating, with the pre-work and the class and everything, and then having to host these trainings. But everyone, almost everyone in school is incredibly capable, especially students. And so if you do have that time, and if you do have that capacity, I would definitely say do not shy away from it. And given I think the impact it'll make for not only yourself but the students around you, definitely a worthy pursuit.
Yeah. Thank you.
I think I have
Sure.
the positive to or comforting thought for some people that might be interested in becoming instructors or getting the basic certification. With the training that we go through and the training that we provide as the basic mental health first aid certification, Ches mentioned the fidelity. They have the same rigor as American Red Cross does when it comes to teaching you to be an instructor and teaching you to kind of not deviate from the information, the objectives and information that need to be presented to the learners. And when you're coming out as a new instructor, you're basically guaranteeing that every training session is going to teach the same objectives. All the people coming out of those basic certifications will be trained in the exact same information. The only thing that will be different will be their local resources that they can access. And so I found that very comforting to know about that high standard of how to operate the courses. And also, if you're thinking about becoming an instructor, they do give you a script that you can work off of as you're instructing, so that you're not trying to maybe remember everything your instructors said to you. There's a script there for you to work with.
Yeah, that's helpful. We're at about 12:57. We have about 3 minutes left, and like many of the questions here, I'm going to pose this last one without knowing what the answers are, or if there is an answer. But as folks have gone through this, both students, faculty, and staff, are there any feedback? Are there any, not case studies, but any encounters that folks have had where they've said, you know what, this training really helped. I was, with my student community over the last week or so, and I was able to help someone or guide them to the right sources. Because one, that's a really important thing, right? That we help students, and faculty, but it also must feel really good to know that you can help someone at that level. And so I'm just wondering if there's been any feedback from folks who have gone through this program and have been able to report back that they've been able to either help someone or guide someone in the right direction.
John, you're asking for new instructors.
Yeah, right.
We can't say, well, yes, this person said this to me, but
yeah.
Heard of people that have gone through it or taught the courses and had people come to them the next day and say, I've already used what I learned.
That's what I'm going at. Yeah.
Yes. I don't have personal stories for you to end on that.
That's
they do exist. And I'm sure talk to us this time next year and all four of us will have personal examples for you.
Yeah, I gotcha. And that's really where I was heading. Have you hearing that from others as well? So thank you. I think the other key area here is, and we're not going to go into it right now, there's not enough time. Dr. Corbett started to talk about the analytics a little bit. And obviously, when we discuss analytics, we have to discuss FERPA and talking about aggregate analytics, but it would be really interesting to understand what those analytics are and how they might help proactive outreach to students, as well as reactive activities, and if it's heading in that area. There is maybe a minute left there, but Dr. Corbett, I'm assuming that that is an area of interest and maybe something in the future we can hone in on specifically.
Well, absolutely. We will be assessing all of the programs that are being implemented through our mental health initiatives. I think we'll see probably more immediately how the mental health first aid training will impact our institutions and the behavioral health needs grants that we are beginning to offer, that institutions will put into place those new programs and resources beginning spring of 2022. So I'm really excited of how it's going to impact student success and help, decrease the amount of anxiety and stress that students, faculty, and staff are experiencing, and begin to see a shift in a positive way because of all the resources and services we are pouring into the system across the state.
Yeah, well, thank you. Thank you for that. And certainly looking forward to learning more about that. And as we close out, I'm not sure if Kelly has any closing remarks, but I will just say, once again, thanks to all of you at the UNC System office, Casey from ECSU, Ches, UNCG, and Ray over at UNC Chapel Hill. We really, really appreciate you partnering with us on this initiative. As you know, there are over 130 people who have signed up to go through this festival, and they've been doing this either through live interactions or reviewing on their own some the recordings and activities that have taken over the course of this month, and we really appreciate it and look forward to working with you in the future. And
Thank
Stephanie,
you.
I'll turn it over to you. I'm sorry, Dr. Corbett.
Thank you for the invitation.
Of course, of course.
Thank you for being here. This was fantastic, all of you, and thank you all for participating. We look forward to seeing you at as the festival continues. Tomorrow we have an event on support coaches with ISG, and next week is our last week with a session on self-care and embracing your authentic self, and also how you can help. That we're presenting with Jetta Foundation. We thank all of you. All of this information, all of the recordings and the resources will be available for all of our participants on the Slack channel, and we'll have it to send to you later. So thank you for now, and we look forward to seeing you soon. Bye-bye.